Welcome to our audience. This is the human connection between climate and health equity. Our program today is hosted by Moms Clean Air Force, Georgia Interfaith Power and Light, and the Georgia Sierra Club. We have a very dynamic and knowledgeable panel for you today. And what we're hoping is that you will, as our audience, have a better understanding of what the connection is between climate and health equity at the end of our conversation. And before we get started with our introductions and with our conversation, I have a couple of kind of thoughts that I'd like to share with the audience, and I think will also be a kind of a prompt also for our panel for them to be thinking about as we have our conversation. And I'd like to start off with a quote from the 4th National Climate Assessment, which is a national report that was mandated by Congress beginning in 1990. And I'm going to just quote from that report. Impacts from climate change on extreme weather and climate-related events, air quality, and the transmission of disease through insects and pests, food and water increasingly threaten the health and well-being of all American people, particularly populations that are already vulnerable. Another fact that comes to us from the EPA and the Environmental Protection Agency does a climate report for all states, and they've suggested that some facts that affect our 159 counties in Georgia, regardless of whether they're suburban, urban, or rural, that the EPA predicts in Georgia that climate change will likely harm Georgia livestock, increase unpleasantly hot days, and increase the risk of heat stroke and heat-related illnesses. Another fact that some people may not realize is that Georgia currently has about 20 dangerous heat days a year, and by 2050, it's predicted that there will be more than 90 such days. Now, I have some good news that was just reported in a news article from the Atlanta Journal-Constitution several days ago, and that is that Georgia is ahead of most states in cutting carbon emissions that are blamed for climate change and putting it closer than many other states for meeting the reduction of 50% of emissions by 2030. The not so good news is that Georgia only has 9 years, and it's going to take a lot of tough decisions, and we'll have to take action in order to be able to meet that deadline. And last but not least, and I think it's very relevant for our discussion today, that the Georgia Department of Public Health has reported that in 2017, that there were 2,614 asthma-related hospitalizations among children between the ages of 0 and 17 years old, and also that the total cost of asthma-related hospitalizations among Georgia children amounted to $37.4 million. So you can see the impact both from a medical standpoint or a health standpoint and a cost standpoint. And also, not only there's Georgia's statistics, but our administrator rather, of the Environmental Protection Agency, Michael Regan, said just a few weeks ago, earlier in May, that the EPA wants to reach people in every corner of this country because there's no small town, big city, or rural community that's unaffected by climate crisis. Americans are seeing and feeling the impact. That statement really resonated with me because, in fact, in Georgia, we do have a combination of rural, suburban, and urban communities. And also what I notice as I talk to people in Georgia, that while they may accept the concept of the science of climate change and they kind of generally grasp that concept, they struggle with what that that what that climate change means to them individually. So I think in our conversation today, it's both bold and appropriate to say climate change is a significant threat to the health of Georgians and especially to its most vulnerable populations. So with that, I'm going to introduce our panelists, and following the introductions, we will begin our conversation. So we have three, again, very dynamic and knowledgeable panelists. They are Dr. Yolanda White, Dr. Maisha Standifer, and Ms. Tracy Sprinkle Dawson. So let me begin with a brief bio from Dr. White. Dr. White is a pediatrician based in Metro Atlanta. She specializes in environmental health. In her virtual environmental health consultation practice, she provides risk screenings, assessments, and guidance to her clients about ways to reduce their body toxin burden and to adopt a more eco-healthy lifestyle. Through public environmental pollution, through public speaking and expert medical testimony, Dr. White communicates the health impacts of environmental pollution and health benefits of safe, sustainable, and low-carbon footprint solutions to healthcare professionals, governments, elected officials, environmental groups, and to the public to strengthen our environmental laws, policies, and health practices. Dr. White's areas of focus include climate change, air and water pollution, food quality, and chemical policy, and she emphasizes pediatric impacts, health disparities, and environmental justice, and has reported racist patient abuses and illegal medical experimentation. Dr. White serves on a number of important committees, including the Georgia Clinicians for Climate Action, the Environmental Protection Agency's Children's Health Protection Advisory Committee, as well as many other committees, both nationally and locally. I'd now like to ask Dr. White if she would just briefly tell us about her current work, and she's just going to take a few minutes to do that. Dr. White, could you please share just some insights about what you're doing now?
Sure. I knew air pollution was a problem when I prescribed an inhaler or a nebulizer to a child patient, and the parent already knew how to use it because their other children had asthma, or they used these breathing treatments for themselves or for their parents. And so when it comes to air pollution and climate change, it reflects, we're seeing that there is a shift in the image from the polar bear floating on an iceberg to someone receiving a breathing treatment, mainly a child or an elderly person. And then it gradually became more common for me to see children, not just with asthma, but also with learning disorders and developmental delays and autism and other environmental related concerns. Not only that, but the parents and grandparents who were coming in with the children also had cancer, were cancer survivors, had fibromyalgia, chronic fatigue syndrome, chronic kidney disease, and other conditions that were either caused by or exacerbated by environmental factors. The same with coworkers and colleagues who knew that I was environmental. They would come to me with their suspicions about environmental contamination in their community or affected by one of their relatives and would ask my opinion about it. And then when I'd advocate and lobby, with elected officials, I would see that many of them were also affected. So it became clear that we were all affected, and this really was a we problem, and more needed to be done. On top of that, it was disturbing to find that African Americans were more disproportionately and systematically more affected to air pollution, especially with particulate matter. And this is supported by a recent article that was published last month in Science Advances that showed that we were disproportionately affected by all sources of air pollution, from industrial, agricultural, traffic, coal, gas, et cetera, rural versus urban, regardless of income. We tended to be more affected. And this disparity was mainly because we were not informed of our risk factors and tend to live within closer proximity to landfills and other sources of point pollution. And the healthcare voice really was the missing link, because when I would advocate, patients would travel to the state capitol and to Capitol Hill and even to hearings and speak about their environmental concerns and how they were affected. Also, many environmental advocacy groups like Moms Cleaner Force would also help organize and strategize and and come up with reports and information about the health impacts of environmental pollution. But I found that the voice of physicians, nurses, and overall the healthcare industry was missing, and there was a lot more that we could do. So I'm very glad to be here with you all. And
thank you, Dr. White. Let me now introduce Dr. Maisha Standifer. Dr. Maisha Standifer is the Director of Health Policy at the Satcher Health Institute at Morehouse School of Medicine here in Atlanta. In her role, Dr. Standifer conducts studies and administers evidence-based prevention initiatives that effectively employ targeted strategies to reduce negative health outcomes throughout under-resourced, racially and ethnically vulnerable populations. She brings her wealth of experience, including health program administration, graduation and research evaluation and research expertise, health policy, development and analysis, mixed methods research, and examining social and political determinants of health. Dr. Standifer is also an assistant professor and co-investigator on multiple federally funded studies. Her research portfolio includes production and implementation in health services research, and along with community-based participatory research to create culturally tailored interventions which empower disenfranchised populations to make healthy and informed decisions. Dr. Standifer received her bachelor's degree at Spelman College, a master's degree in public health from Morehouse School of Public Health at Emory, and a doctorate in applied anthropology with a concentration in medical anthropology from the University of South Florida. And I have to say, I particularly love that medical anthropology degree. Dr. Standifer, please tell us some about what you're doing in your current work.
Well, great. Well, thank you for inviting me to be here, Ms. Cooper. I am thoroughly excited because, again, I am an undergraduate institution and a product of an HBCU, and now at a historically Black institution, training the next generation. As Dr. White talked about, that training effort it's unprecedented right now, especially now in the climate change and environmental justice movement that we have. I started my environmental justice in the grassroots space here in Atlanta, Georgia, focusing on environmental advocacy and mobilization within the urban Atlanta, focusing on landfill placement and detrimental health outcomes. So it's near and dear to my heart from the 90s when I was very active, starting with NAACP and some of the movement that was there. And just in terms of coining the term environmental justice, what it is, looking at over the years with policy action from Clinton on up through to now, which we're excited that we are in a climate, in a political climate and a political landscape where there's much advocacy. You mentioned EPA. We know of now kind of pivoting right back to where it used to be. And on that landscape, and initiating some policies and regulations, getting back to scientific, regulation that is accepted and will be mandated, of course, over the next few years. We're excited that our current President Biden is also an advocate of our work. But more importantly, we have some federal legislation that's been introduced, the Omnibus we talk about with Senator Cory Booker initiating that. We talk about moms and we talk about maternal health, but Black moms, right? Because we know that who are detrimentally infected and disproportionately impacted are people of vulnerable communities and Black mothers, right? So we want to just examine that landscape and talk to it a little bit in terms of educating, informing, and advocacy and mobilization of those who are in the community and those who are going to kind of possibly impact, right? So right now we have several initiatives going on at Satcher Health Leadership Institute, particularly focusing on educational aspects with climate change and environmental health equity and political determinants of health. And with great work with Environmental Defense Fund, we're working to create a series of webinars with congressional members. We're excited that we hosted our first educational webinar last fall with the head of the House Committee, Select Committee on Climate Change, was Representative Castor from Florida, and she's an advocate and has initiated bills in the last year's session and preparing to initiate the current one, where we're looking at the efforts. And she is really impactful, looking at and focusing on communities of color, Black, brown, tribal, indigenous populations throughout the U.S. And so that's great. As I mentioned, we have other representatives and senators also in that level. But then we need to drill on down when we're talking about statewide. Ms. Cooper, we talked about Georgia, and we know that Georgia is getting it's increasing their work. We need to definitely look at the impact that's there and what could be improved upon. We can look at examples of Illinois and New York that have climate change councils that have been established. And then trickling on down to local level. We know that local level politics is crucial, especially when we're looking at urban and rural and suburban populations. And we also need to look at those who often don't speak our language or English, right? And so we have to look at those communities that are not, that don't come to the table because they don't have the English language down. So we have those who are really who are impacted, such as migrant farm workers or those who are in an occupational unfriendly environment. So we need to speak to those environments, definitely in terms of policy-wide and actions that we're doing. And so we're working alongside some Georgia Georgia members of the House, where we're working with environmental equity in Fulton County and throughout the southern region of Georgia. And we're looking at how do we educate, mobilize, but also create sustainable resources. It's not just for the time being. We're not just talking about a year. We're not just talking about a 4-year term or 2-year term. We're talking about sustainable efforts that will be there to grab. So we're excited that we have everyone on board, where we're looking across the lifespan. We're looking across, not, of course, with moms and women, but also getting everyone from, older populations and Black and brown communities to talk about this and come together on a common platform where we're getting policy makers and we're getting those who are community advocates and policy advocates to work in line with some of our efforts and what we're trying to do.
Thank you, Dr. Standifer. I'd like to introduce our third panelist. And I want to say that Ms. Dawson, like many professional women, successfully manages multiple roles. She's an experienced healthcare attorney with a degree from Howard University School of Law. She's a registered nurse with a degree from Tuskegee University. And she's worked in labor and delivery at local Georgia hospitals prior to pursuing a law degree. And after practicing law for over 19 years, she established the Sprinkle Dawson Law, LLC law firm, which is dedicated to helping healthcare companies and medical professionals in the drafting of contracts, policy, and procedure manuals and privacy compliance that are consistent with federal and state regulations. She's also providing advice and representation to a broad array of areas in employment law. And she's active with state and local bar associations and multiple community service organizations. But in addition to all of those things that she's doing professionally, she's also a wife and the proud mother of an energetic, multi-talented 9-year-old son, Kyle. Kyle is a third grader who excels academically and as well as being a gifted musician and a multi-sport athlete at 9 years old. And although it doesn't seem to have slowed him down at all, Kyle was diagnosed with mild, persistent asthma as an infant. And Ms. Dawson will please, if you would now, share with us how asthma and climate impact Kyle and your family's daily routine.
Sure. And I'd like to just say thank you for inviting me to join this panel. I think it's a very important discussion. I, definitely, as I would say, as a parent of a child with asthma, and also being a healthcare provider, I felt I was better equipped to help my son with, making these adjustments. But as a new parent, it was very, very challenging in the beginning. Initially, even with just getting the diagnosis. I worked very closely with his pediatrician, who, our family, we love her. She's been his pediatrician since birth. And initially, he demonstrated certain symptoms that made us concerned about his respiratory status. Some wheezing, some coughing, and it was just over time. And we were troubleshooting, trying to figure out, was it just a cold? And eventually the diagnosis was made maybe around the time Kyle turned 2. So at that point in time, in collaboration with our pediatrician, we decided to send him to a pediatric pulmonologist just to make sure, that we had, the very best care that was available to us. I'm someone who specialized in pulmonary conditions. And he works, our pediatric pulmonologist works very closely with our pediatrician, and she's also very knowledgeable as well. And so we just work as a team, but it's certainly been a journey from age 2 to now, age 9, making sure that we stay on top of things, making sure that we're aware of certain triggers, paying close attention to what's going on with Kyle medically, and also just and he's an active child. So, in play, wanting to monitor him. Hey, Kyle, how are you feeling? Are you feeling winded? Always making sure that we stay on top of things in case, he needs an inhaler. He needs his inhaler and having it on hand at all the time, and communicating with his coaches, his teachers, school administrators, making sure they're aware of, his medical condition so that, we can all collaborate and work as a team. That's been my role and my husband's role as parents. And I'm happy to report that right now, we're in great shape. We feel, that our team works really well together. His asthma is well controlled at the moment, and we're looking forward to that continuing in the future.
So, Ms. Dawson, because he is 9 years old, I presume that he is in school, even though this last year he may have been working remotely some of the time or all of the time. But when he's in either at school or in sports activities, or perhaps even when he was in pre-K, how did you work with his school or his health or his daycare setting in order to make sure that they understood what the risks were for Kyle?
Having open communication was key. I spoke with, when he was in daycare, I had a very good relationship with the administrator of the daycare center. And she also, and it just was very fortunate that, not fortunate for her, but fortunate for us, she has asthma. So she was very aware of symptoms and very aware of the need to, be responsive and reactive. And she also made sure that her staff was trained properly to recognize signs and symptoms. And so I felt very comfortable leaving my son, in their care. That made me feel very good because, when he was a baby, I just had a certain level of apprehension of making sure that when he's not with me, that, there's someone there that can respond appropriately if needed. And so that translated into when we, started school, having those same relationships, making sure that I communicated with the school nurse and that she knew who I was, that he wasn't just, Kyle with asthma. This is Kyle with asthma. This is his mom, introducing myself. and also having frequent communications and working with our pediatrician that because the schools do require an action plan, having that action plan on hand, making sure that the school nurse and also the teachers and administrators are aware of, his condition, and making sure they have all my phone number, my husband's phone numbers, access in case there is an emergency, which they would have anyway. But I just wanted to make sure that it's always top of mind in the event that something, happens or if I'm needed, I'm accessible at all times. And that was very important to me.
Dr. White, Ms. Dawson just mentioned action plans in her discussion and talking about Kyle and how his care is managed through his school. And I was curious, because you are a pediatrician, what your experience is with action plans.
Yes, I appreciate Ms. Dawson emphasizing two things, communication and teamwork. Both those are very important in keeping her child healthy and safe in school and avoiding any missed days at school. And as a pediatrician, we fill out lots of forms, and it's not just the asthma action plan, it's also the authorization to administer medication and sports physicals, where we provide recommendations to the school. And I have to admit that my recommendations may be a little bit more extensive than others and might include precautions about remaining indoors during red and orange air quality index days, which means that the school would have to monitor it each day, especially in the summertime during smog season, which extends from May until September of each year. And here in Georgia, and with climate change, it may start a little bit earlier and end a little bit later. And also taking precautions on high pollen count days, or days when children are playing or practicing sports outdoors on hot and humid days, and also including recommendations on staying well hydrated with water or Gatorade or some other electrolyte drink. I may also include recommendations on no car idling or no smoking policies near schools, and some schools have already adopted these, but other schools have not. And also schools can also avoid strong cleaning chemicals or use caution with strong laboratory chemicals around students, all students, but especially students with asthma.
Dr. Standifer, the American Lung Association has reported that asthma is the most common chronic condition among children. Acknowledging the link between poor air quality and asthma, generally, what policies are working to impact climate injustice within vulnerable communities, in your experience?
Thank you. Yeah, from my experience, I think that a number of policies have worked and have not worked. Hence, as I pointed out, the Omnibus bill that was introduced federally from Senator Booker, right? And I think it's great that we're talking about policy right now, because we're looking at a more comprehensive state, because we're noticing that the Clean Air Act and other policies that were federally implemented and going down to each state, and I'll talk about Georgia briefly, we were finding that there are some communities that are naturally kind of not at the table or being kind of omitted from some of the action. So it's great, as we highlight the Omnibus bill, it's to be more robust, act to include moms, Black mothers, right? To talk about maternal health outcomes, the care that's received, discriminatory practices, bias and implicit, and just obvious bias that is in operationalized within the healthcare system and in public health emergencies, and responsiveness and responsive actions that we have when we're looking at birth and climate actions. And so I think that it's really good that American Lung Association is taking some of the steps and the efforts and highlighting what's happening. But again, we in terms of climate, actions and activity that's occurring. But we need to make it, as we know, very robust. We need to talk about what's happening in natural resources. It's really great, as I talk about with Biden being such an advocate for environment and equity and climate change. We're looking at the nomination of Deb Haaland, where we're looking at the Secretary of Interior, because we know that, it's not just, the myopic thinking or being in a siloed about air quality. It's about the climate is there. Air quality is part of it, but we're looking at the impacts of climate change. We're looking at flooding. We're looking at detrimental landfills, where they're placed. So it's a very robust kind of picture that we need to look at. And in conjunction with air quality, we need to look at interior design, land management, policy landscapes, and what's happening to not just correct some of the inequities linking to environmental injustices and health disparities, but looking at some of the outcomes. I think we talked about earlier about what's happening with some of the energy emissions, right? And we know that those are, energy emissions can detrimentally impact communities of color more so. And so we just need to be cognizant of that, what's happening. Georgia has been somewhat, there's been some movement, right? But we need to have it a little bit more when we're talking about local efforts. And we're talking about, as I mentioned, getting together with some consortiums. We're looking at institutional connections, where we have the HBCU Climate Change Consortium, working with the Deep South Center for Environmental Justice, and just a number of institutions that are getting together, even Environmental Justice Consortium. And so we're talking about green is the new black. Right? It's the new thing to be hip, to be cool. And so we're changing the color. We're making it our narrative, right? And so we need to make sure that Black mothers, Black women, or people, again, not just Black, but those Black and brown communities, maybe that, again, don't speak English, getting into those rural communities, that we can bring them along. And let's not forget those individuals that just are not not institutions of higher ed, but those who are often in community and settings that, again, are, maybe advocates, but don't know the path or the journey. And again, this is what we're doing at Environmental Defense Fund. And I also want to talk about how, as Dr. White highlighted, practitioners and clinicians can get involved, right? As she mentioned, she's an advocate. We have advocate scholars like myself who are able to go and talk on behalf of some citizens. And you're bringing citizens and community health workers along, but we need to implement that in the curriculum, in the development, not just pipeline training programs K through 12, but continuing those programs which we're educating at Morehouse School of Medicine and Satcher Health Leadership, and continuing to integrate that into the curriculum of students, residents, and, in grand rounds where, doctors are saying, well, what's happening? What's going on? And Dr. White is very, she's very fortunate to be in a setting where we can have the educational component there, definitely integrated into the curriculum, because the next generation will see more and more, right? Asthma rates increase. It's not just asthma rates, but cardiovascular influences and neurological impacts, looking at neurological impacts of lupus, possibly, of course, autism. So we're looking at all of the factors that can be associated with climate change. And so training that next generation that's going to be there and to be hands-on, and also to be advocates for those who are often not able to speak or be at the table.
That's kind of a logical sequence there for me, is that Dr. White, you just heard Dr. Standifer talk about the training aspect, but as a physician and as a pediatrician, what are your thoughts about expanding physicians' roles in considering environmental impact on health? In particular, because you incorporate environmental concerns in your practice, how is that different from other physicians?
Yes, I would like to see more physicians take time into examining disease clusters. We have disease clusters all over the place. Now we have so much asthma that it's just considered normal, but in fact, the public health statistics from the CDC and the EPA will estimate asthma as being seen at around about 9 to 12%, depending on the age. In fact, in practice, I'd say maybe about 30% of children have asthma, even if it's just mild intermittent asthma. Even if they just need an inhaler to help them during flu season, during the winter months, it's much higher than what we are, than what is actually reported. But oftentimes when we do see disease clusters in our communities, we just say, oh, we see a lot of this in our area, but we don't really understand why, and we don't investigate it. But if we did investigate, then we might discover that there's actually an environmental etiology contributing to it. And also, many physicians are overburdened with unfunded mandates and overworked, and it's such a fast-paced environment that we don't have time to examine anything else that's not so obvious. And a patient is not going to come in and say, I live across the street from a coal plant. I live near a landfill. So we have to actually do this type of screening. And that's actually part of what I do. I do risk screenings, I do assessments, and I also do consultations. But there's no like institutionalized way an institutionalized process of billing for this extra work to address these environmental contributors. And also, Dr. Standifer, earlier on, she mentioned implicit bias. And with regards to asthma, I would like to see physicians eliminate race correction when conducting pulmonary function tests, or PFTs, which is a tube that you blow into. It's connected to a computer, and it helps to measure your lung function. You have to enter age, height, and race and get a result. But when you enter African American race, you get a false result of a lung function that's overestimated by 10%. If you enter Asian race, you get a false result that's overestimated by 6%, which means that the test is not very sensitive and picking up those who have a lower lung function. And with African Americans, we're more, have higher rates of asthma and higher exposure to air pollution. So we need the most sensitive test. So either eliminate the race factor, or just use white race for everyone. And lastly, I also want physicians and nurses to know that CME, continuing medical education, and CNE, continuing nursing education credit, is available on the EPA's website for those who want to learn more about the health impacts of environmental pollution.
Dr. White, as you were talking, one thought occurred to me. You mentioned about inhalers and equipment that might be needed by a child with asthma. For families that have fewer resources, are there many impacts in terms of either the support or the medications or equipment that's available to them in order to be able to manage their child's asthma?
Right now, when it comes to inhalers, you really do need a prescription for albuterol. About 20, 30 years ago, when I grew up, they sold Primatene Mist over the counter in stores, which was a bronchodilator that helped to open up your airways. But now you need a prescription. Therefore, you have to have health insurance. And if you have Medicaid and you require an inhaled steroid, it's going to be a little bit tougher, because as a pediatrician, oftentimes because inhaled medications are so expensive, the formulary changes. You might prescribe one inhaler on one visit, but then a year later or 2 years later, it's no longer on the formulary because the price had gone up. So that highlights an economic injustice that also exists that we need to consider. And also, due to my own personal environmental concerns in a home that I lived in, I was exposed to high levels of particulate matter inside my home. And I had to pay for an air and mold inspection. And that report was that inspection and the report was pretty costly. It was almost $500. But I was able to find out and document that, yeah, I was exposed to particulate matter, even though, there weren't any too many strong signs. It was just something that I was I had a high index of suspicion for. But who can afford that? How many people can afford these measures? Which is why I also support the omnibus bill that Dr. Standifer mentioned, because it provides for many of these environmental interventions, such as weatherizations and air filters and even air conditioning and all these other control measures that can help us to manage asthma and other environmental related conditions.
That leads me to ask Ms. Dawson a question. As I'm listening to some of these challenges that are presented to parents of children who have asthma and how poor air quality is linked to that. Ms. Dawson, as you have navigated the journey as the parent of a child with asthma, what would you like to share with other parents, particularly those with less resources, perhaps, or less access to healthcare in general, or less knowledge as you possess in terms of navigating asthma management with their child or children?
Well, I would probably recommend taking the time to make yourself educated, about the condition. What is asthma? What are the triggers? How does air quality impact asthma? Being aware of your environment. Because of course, living in a more urban environment, you're exposed to greater pollution generally, and you may have to take more precautions than someone who may live in an environment where there isn't as much air pollution. And also making sure you have, again, as I mentioned earlier, open lines of communication with your healthcare providers, with the school, if your child is in school, or the daycare administrators if your child is still young and in daycare, and also your community. Because I had to, educate my parents, because they are caregivers of my child from time to time. Making sure that they understand, what to look for as it pertains to signs and symptoms of an asthma attack, and how to, approach that, and what to do using the inhaler. And now that my son is getting older, my focus has been pretty much on helping him understand, what he needs to do to take care of himself in my absence, or in my husband's absence. And he is very well aware of the condition. I think, speaking to children at an early age on their level about asthma, so that they know that they have asthma, they can communicate to others. I have asthma, I'm having issues breathing, and making them aware of, what the symptoms are: chest tightness, coughing, anything that will help them understand how they can, maintain a level of health and wellness as they get older. And I think they take on more and more responsibility as they get older, because of course they're not around their parents as they age. Of course, they're around their playmates and their teammates, and having that inhaler with them at all times. The importance of that. All these things are things that I would stress to parents, as well as making sure that they really let their child know that they can live healthy, active lives. And that's something that my husband and I, we really stress, that we want him to live a healthy and healthy, active life. We want him to participate in the sports that he loves, but also understand, okay, we need to listen to your body. We need to assess the quality of the air, as the other panelists mentioned, because today might not be a good day for you to go out and play in this, sport, because of the quality of the air, or, it's really, or this, it's high pollen season. So those are the things that I would really stress and emphasize for other parents, is education and open lines of communication with your team as well as with your child.
I really appreciated listening to your three different perspectives and how they blend as a physician, a policymaker, and as a mom of a child with asthma. And as we come to the close of our conversation, I'd like to give each of you an opportunity to briefly share with our listening audience any final thoughts you have about some actionable steps that communities, organizations, and policy advocates can make in moving the needle forward in environmental health, environmental justice, and health equity. And I'd like to start with Dr. Standifer.
Yes. And so we know that our nation is experiencing and will continue to experience detrimental health impacts due to climate change, right? Climate change is worsening, of course, with ozone and particulate air pollution. And so it's causing, premature deaths. That's what we highlight. And it is key, and it's key for our institute, where I am, and also policymakers to collaborate, partnership, negotiate, whatever term we want to use. We need to have key individuals, organizations, and those legislators working together, whether it be, again, in southern rural Georgia or urban Atlanta, or even, again, urban locations where heat islands are impacting communities of color. And we need to make sure that our language and our narrative is directly relating to those individuals. Again, we talk about equitable reduction of power plants and transition, and we talk high knowledge, but we need to make sure we are on a level playing field where we're able to just be transparent, communicate with that mother of four who it's may not be a priority, or she doesn't see it as a priority, making sure that her windowsill is clean in her child's room that's experiencing asthma attacks, or certain things, or mold. Education is provided to these impacted communities. So we need to make it more approachable when we talk about climate health, climate change. Like I said, we need to change that and make sure that we say green is the new black, and make it the sexy messaging, and to make sure it's there and be approachable, and be, just in terms of attaining those communities that are highly impacted. And that is what we plan to do at Satcher Health Leadership Institute.
Dr. White, may we have your thoughts?
Yeah, my thoughts are really expanding that whole team approach and realizing that, this whole process of climate change, we all play a role in it. And so therefore, we all play a role with the solutions. So I would really want us to get to the root cause of the environmental pollution, and make sure that we hold the different corporations and industries responsible, and hold them responsible to exploring safer alternatives. And also we hold our policymakers accountable to enforcing our protections. And also we have to look at ourselves and make sure that we are also conserving our use of electricity and energy and heat and air conditioning as much as we can, and realizing that this is a global problem. Even our activities and actions that we're using in our industrialized nations, it's affecting those of us who live in the diaspora. So yeah, and if all the energy, if it comes from, and even with the heavy metals and all these pollutants, if they come from the earth, we really have to keep it in the earth, and we have to really make a swift transition to cleaner, renewable alternatives.
And I want to give Ms. Dawson, if she has any last comment before we close out our conversation.
Sure. I think that one thing that I would like to emphasize is the power that we have as citizens in our community. The need to communicate with our elected officials that this is serious and that we need change. And as parents, and not as a parent, that's something that I need to do, to make more of an effort of, being present and being visible and being vocal. I think that is what effectuates change, and being a part of organizations that that are really pushing the narrative and making people understand the importance of climate change, how it's impacting our children and our community in so many different ways, and be an active participant and in all of the roles that we can. I think those are the things that we as individuals can do as well.
Oh, that really resonates with me, Ms. Dawson. Thank you for that recommendation. And I just want to mention that it's been reported that about 3/4 of registered voters in Georgia believe in climate change. And so I would encourage all in our listening audience to make sure they share their views and opinions with their legislators.
Absolutely.
And on that note, what I'd like to do is to thank each of you for your time today, for sharing your knowledge, for sharing your experiences with us and with the listening audience. You've given us a lot to think about, and it certainly is a great foundation for Moms Can Air Force and our co-hosts, Georgia Sierra Club and Georgia Interfaith Power and Light, to have further conversations about the human connection between climate and health equity.